Sometimes when I see a consultation for a tummy concern, my patient likes to ask, well, should I do liposuction or should I do a tummy tuck? And how do you decide when the result you want can be achieved with liposuction versus a tummy tuck? Two things that I look for tummy tuck patients. One is there separation of the rectus abdominis muscles? That just means if you've gained a lot of weight and lost it, or if you've had children where your tummy has stretched and come back once, twice, multiple times, the ab muscles that are supposed to be lined up in the midline can become separated by all of that pressure from the intra-abdominal contents or your intestines and stuff. So that's the one thing. And how do I test for that is I'll lay you flat on your back and I'll have you do a leg raise. And that means I'm having you raise both legs at once. And when you do that, you engage your core. If there's a bulge in the middle, I feel for it and I try to see how many finger gap there is. If it's more than a 2-finger gap, then you probably need a muscle repair. The other thing I look for when it's a tummy tuck versus just the liposuction is how much extra skin you have. If you have a flap of tissue that's hanging down over your pant waistline, or that you feel like you have to tuck into a Spanx or tuck into something so that you can hold it in, that usually tells me that there's skin laxity, there's extra skin and fatty tissue that needs to be removed. If we just did liposuction, chances are that amount of skin is not able to contract enough to get you a nice flat tummy contour. So that's how I decide if you need a tummy tuck versus just liposuction.